Mayor, you're on. All right,
okay, I'm here.
Oh, Mayor.
Hey, Jim.
Hi, sir.
Sorry about that. I was talking to Matt Barnes.
That's right. Tammy, are you on?
I'm on.
All right. Tammy, do you have anything today? If not, when we go through, I'll skip you. It's up to you.
No, nothing for the public.
Okay. Thank you.
Thank you.
Chief Value, have you joined?
Yes, sir.
All right, Chief. Okay, who do we have from the media?
Manon Mirabelli from the Republican.
Hey, Manon. Good morning.
Good morning.
Okay, we have the Republican. Anyone else?
Taylor Knight from 22 News.
Thank you.
Hi, Taylor. Thanks for joining us.
Hi.
Okay, we got Republican and 22 News. Anyone else? Anybody else
Hi.
on the media?
Hi,
Yes.
it's Kate Phelan at the Chamber. Good morning.
Morning.
Hey, Kate.
Hello.
Hi, Kate.
Hello.
All right. Anybody else from the media? Okay, I got a Republican. I got 22 News. All right. Well, it's right at 11 o'clock. We'll get started. Hi, this is Jim Wiggs. I'm the Emergency Management Director for the City of Westfield. I'm working very closely with a group of individuals leading our response for the city for COVID-19. I'm going to turn it over to the mayor for some opening comments, and then we'll turn it over to public health, and then I'll call people in order as we go through this call. Please hold questions to the end, and then I will call on the media at the end after all the departments have spoken. So, Mayor, you got any opening comments?
I do, Jim. Thanks very much, and thank you to our friends in the press for joining us. Also, thank you to those folks who are listening today. We have been meeting every 2 weeks as a group. Although this is just what you, although not see, but hear today, we do this almost every day at City Hall with the department heads and groups around the city of Westfield to do what we need to do to address coronavirus in the city. And we thought we'd come to you again this week just to give you an update. Thank you for tuning in and listening to each of the professionals who will speak after me and tell you about what is going on here in the city. Obviously, as the weather improves and things get better, people are itching to get outside. They're itching to return to their normal lives, and we agree 100%. That is our goal as well. But ladies and gentlemen, I don't think we're there yet. You heard the message from Governor Baker this week about extending the date until May 18th, to which we try to begin to resume some normal living. And so we're going to say and ask firmly but humbly to each and every one of you to please do your part. Follow the directions of Governor Baker and in the directions here of the city of Westfield to maintain your distance and to continue to follow the protocols that we've asked you to do now for going on almost 2 months. There are some indications around the country that it's working, although we might say here in the city of Westfield it hasn't yet had the benefit that we want it to have. And I know the temptation is great as the weather improves to get together with friends and family and pretend that there is no problem and there's no issue and there's no need to social distance. But there is. And I think we all know that's the case. So as you hear from the professionals that will speak after me, you will see that our community is doing its very best to address these concerns by a department to department basis, but we certainly can only do it with the help of the constituents and residents of the city of Westfield. So we're going to ask that you keep doing it for just a little while longer, a couple of months or a couple of weeks. We can see the light at the end of the tunnel, but we need your help. Thank you again for being with us this morning. And I think, Jim, we're going to turn it over to Joe Rouse in Public Health.
Yes, sir. Joe, go ahead.
Thank you.
Okay. Thank you, Mayor. Good words. Well said. And I'll reiterate that a little bit just from the public health perspective. So we do need to continue to be very diligent. I know there is the desire and like I've said before, people are trying to will this to be over, but that's just not how science works. So we need to still observe, the reports that we're getting, the advice that we're getting from the state. I have a phone call with them daily to get any sort of updates on what's trending and what the models look like, all the way from the eastern part out to here in Westfield. So right now I can say we're up to 341 confirmed cases, not including the ones that we'll report out later today at 4 o'clock. And we are also starting today going to start to disseminate the numbers, the mortality numbers, and that will go out also at 4 o'clock today on our website. And hopefully with that, now I think we're at a time where it never really been resistant to release that number before, but it's a little bit harder number to get an accurate result for than our confirmed cases. So the state has made it a little bit easier in our monitoring software to be able to get that tally. So, but we're only going to release the number of deaths once a week. And again, also just to go back to what the mayor was alluding to is that, our numbers are not going down right now. So when you talk about being at surge or peak, we still continue to be there. We're not even plateauing necessarily. So the numbers continue to go up, and a lot of that has to do with some of the congregate living facilities, nursing homes, assisted living in the city that are starting to see clusters. There's a couple right now that we are working very closely with to get that controlled, and we'll probably bring in the state as well. So those numbers are added to our daily confirmed count. So, as long as we have clusters in nursing homes, just like everywhere else in the state is having the same issue, then you're going to see those numbers still remain in the double digits. Once we get control of those facilities, the numbers are going to go down, just for the general population numbers. And even at that, it's not the time when anybody should let their guard down. So I know, you're looking at the media reports right now in the southern states that have just decided that this is all over for whatever reason. It's not. We're still in the thick of it, and you need to take all the precautions that we were talking about 3 weeks ago. So just pretend like we're still back then. And the masks are another thing now that are getting out there. The cloth masks are, we encourage the use of that for everybody when they're in a public place, especially if you can't social distance. So the mask wearing is highly encouraged by our department. And then also just a final fact of the matter is that we have found social distancing is pretty much the number one thing that's preventing the spread from person to person. Very important to continue doing that. And again, all the other precautions that we've been talking about with hand washing and unfortunately, I still have to say my advice is to everyone, until the non-essential ban is lifted, is to stay home. That's really what we all need to continue to do. I know it's unbearable and it's been a long time, but we are looking at a potential resurgence of this virus if we are not diligent right now, and it could potentially be even worse. So we don't want that to happen. That's a factual statement. So everybody needs to be on guard. Thank you.
Thanks, Joe. And okay, this is coming to my portion of the presentation. Basically, in the EOC, we're in touch with MEMA, Mass Emergency Management Agency, daily, and we do a check-in with them. We update our web EOC page, and we obtain supplies primarily through Mass Emergency Management Agency. Right now, we're not burning through supplies at the rate we were in the beginning. We have supplied police, fire, public health, and other departments with things that they need to make sure that their staff and are safe, and also when they transport, if they have to transport anyone, they can properly clean their vehicles afterwards. In addition to that, we're making sure also that supplies are provided to dispatch as they change shifts for their 24-hour operation. And then with the donations, we have made a number of stops at the assisted living facilities, the long-term care facilities, and provided them with everything from gowns to booties to gloves and masks that we receive. Whenever they run low and their vendor says they may not be able to resupply them in time, so they don't run out. So we are working very well together as a team and keeping them supplied. And like I said, we're not burning through supplies at the rate that we were in the beginning, and that's a good thing. But we realizing that we started basically with no mask, and then we had to improvise. So in the beginning, when we did get masks, we were burning through them at a faster rate than we're seeing pass through the Emergency Operations Center at this time. So with all that said, I will turn it over to Chief Valier from the Police Department, and then after Chief Valier will be Chief Agloff from the Fire Department. Chief Valier, go ahead.
Thank you, Jim. Good morning, everybody. Chief Valier from the Westfield Police Department. Our department is currently down one officer which is COVID related, and he is returning tomorrow. So we're happy to report that we'll be back to full staffing. Our public safety mission continues without any issues whatsoever. Our personal protection equipment has been well supplied. Thank you, Jim and Emergency Management, for taking care of all of our needs in that regards, and for your leadership throughout this crisis. So other than that, we're good here at the Police Department.
Thanks, Chief.
Chief Agloff.
Hello, all. This is Patrick Egloff. I'm the Fire Chief of the City of Westfield. Other than fire operations here in the city, as you well know, we run 4 fully staffed advanced life support ambulances here, 24 hours a day, 365 days a year. And I can say that all fire and EMS operations continue without interruption. Currently, my staffing is much different than it was just a couple weeks ago. I only have one person out right now, COVID related, and they are on the mend. And we're hoping to have this person back within the next couple of weeks. We are very good with PPE, like Chief Valier said, because of emergency management and all they have done to help us get the PPE we need, either from donations or through MEMA. And I would say if we continue on the way we are right now, we're good for at least the next 3 weeks at our current call volume. While it appears our COVID-related EMS calls in the community have decreased overall, our calls to skilled nursing facilities have increased in volume, and that goes to what the health director, Joe Rouse, had said. I want to go and put out a big thank you to the citizens of Westfield who have taken this pandemic seriously and have social distance and stayed home throughout this. And I just want to say that now is not the time to let our guards down. Please keep practicing social distancing in accordance with what Governor Baker had said yesterday. And this will help to prevent a spike or surge in our community. Thank you all, and that's all I have for this at this time.
Thank you, Chief. Nina?
Hi, good morning, everyone. I'm Nina Barsh. I'm the director for the Public Safety 911 Dispatch Center in the city. And I don't have any updated information for our citizens since the last time we had this on-air conversation. But we are still taking calls daily for service and screening each call for anyone who is on scene who may have COVID-19 or COVID-19 related symptoms. Again, that's for our first responder safety as well as the citizens, so we know how to prepare the responders for arriving at someone's home. We are still taking many calls daily for incidents related to the virus, and like the fire chief had stated, that they do seem to be down a little bit, but again, we are still getting those calls, so it just goes to show that it's still present in our area, in our community. So so I can speak on the fact of continue to stay home, shelter in place when you can. If you have to be in a store, wear a mask. And we got to still keep using our precautions to make sure that this virus doesn't spread more. So that's all I have for the dispatch center. But now, if you don't mind, Jim, if I could speak on behalf of Director Tina Gorman from the Senior Center. She was unable to participate in today's briefing because their distribution for meals goes from 11 to noon. So she was tied up all morning with phone reservations and prep work. So she had stated that they are now averaging approximately 125 meals per day for the Senior Center curbside pickup. And they had been giving out cloth masks at the request of those picking up meals. So that's very good that they're giving those out to the citizens. And she says, as the anxiety mounts in our senior population, they have now done 400 plus telephone reassurance calls, and they will continue to contact participants from the various Senior Center and Council on Aging programs. And all crisis cases are being referred to their outreach coordinator. They have been working with city's media specialist, Peter Coles, on utilizing their local cable channel 15 for some fitness, educational, entertainment programs for the seniors during the month of May. And those programs will begin next week. And they also continue to loan out medical equipment. Many of the borrowers are getting services through Bay State Home Health. And she also said that if you had any questions for her directly, to reach out to her via email or phone call. And that is all I have. Thank you.
Thanks, Nina. That's a good segue to our community and schools. Stefan?
So this is Stefan Zaporowski, Superintendent of Westfield Schools. I wanted to just elaborate, since the governor has closed schools for the remainder of the school year, our school lunch program will continue. And we have 4 locations. It is South Middle School and Franklin Avenue Elementary School from 11 to 1, and then Powder Mill Apartments and Colonial Pine Acres from 11:30 to 12:30. And students will be able to pick up, again, they get a lunch and something for breakfast for the next day. And we're going to do that right through June 29th. We have the funding and permission to do it right through June 29th. So as of now, we've been serving up to 950 to 1,000 meals per day. Remote learning is continuing and will continue now for the rest of the year for Westfield Public Schools. We have now distributed, including yesterday, over 2,000 Chromebooks to students and families. Our last day of school for our seniors this year will be May 29th. We do have a committee of students and staff right now working on a plan so that we can appropriately celebrate the class of 2020. So that information will be coming out shortly. And then finally, the last day of school for all students is June 23rd. And that is all from the school department today.
Thanks, Stefan. And I think everyone heard a common theme throughout this is, continue social distancing, keep doing what you're doing. It does make a difference. And we want everyone to be safe. With those comments, I will begin taking questions from the media. All the questions we routed to Joe Roush, and then Joe will deflect the questions to whomever he deems appropriate if it's not
Jim,
his face. Yes.
Jim, Lieutenant Bart on the line.
Yes,
I just want one thing I want to send out to the media. Church of Atonement continues to give out meals on Saturdays from 5 p.m. to 6 p.m. They will continue this program to the end of May based on all the donations they've received up to date. But they have been giving out 200 meals, and Westfield Food Pantry has piggybacked on that program as well, and they gave out 100 grocery bags as of last Saturday, and they will continue to do that through the end of May.
Yeah, excellent. Thank you. That's a nice ad. Okay, Republican, do you have any questions?
Hi. No, I have none. You've answered all of my questions. So, Joe, today at 4, you'll have a mortality rate?
Yeah, we're going to put out a number based on what I can get this afternoon, so it'll be as accurate as possible, yeah, but at 4 o'clock we'll put that on the website.
Okay, that's all I need. All right, thank you.
All right, 22 News, do you have a question?
Yeah, for Mayor Humison, I know that you said that social distancing hasn't had the benefits that you wanted it to have so far. Can you just explain a little bit more what you mean by that and what people are maybe doing wrong out in the public right now?
I apologize if I gave the impression that social distancing wasn't working. Social distancing is apparently the only thing that really is working. So I think what I meant to say is that our numbers still seem to be higher than we'd like them to be. And so, especially based on days like today where the weather looks good, I see people flooding out of their houses and trying to get into the parks and trying to be out and about with each other. And that kind of defeats the purpose of social distancing, right? The whole goal is to try to keep people separate so that if anyone does have the virus, they don't spread it to each other, family members, friends, colleagues, coworkers, and that kind of thing. I think we get concerned when we see people in the grocery stores or the department stores, and I know now the rules have changed so that those stores are trying to keep or have to keep the number of people down that can go inside at any one time. But it doesn't do anybody any good when we kind of pile on top of each other or try to get close to one another. And so I guess my message to people is to try to continue to keep that distancing, that physical distancing, that social distancing that we've talked about, because it is the one thing that is working. Is that more clear, Taylor?
Yeah. Has the city talked about closing down the parks if people, when it gets nice out like today, just really can't listen to the social distancing mandates?
Go ahead, Mayor.
Go ahead.
Did you ask if we're considering closing down the parks?
If that's been talked about, yeah.
The parks and playgrounds have already been closed, and that's been the case for a while. So, that it is monitored also.
We actually removed bets and things like that, so that there wouldn't be the temptation to go and play a pickup game of basketball, for example, to try to keep people separate. It also makes it easier for the police to enforce.
Thank you.
Thank you.
All right, so we had the Republican 22 News. Did any media join after I did roll call that has a question?
No, this is the Republican again. I have another question.
Sure.
Okay, so the public parks are closed. What about Daley Park that is pretty well populated on days like today? Do you have any kind of control over that, or have you discussed it with Bob over there?
Yeah, I'll say that I have spoken to Bob McKean, and he in turn have spoken with their board at Daley Park, and they're sort of looking for direction as well. They have made the decision not to open the park. Typically, the park wouldn't even be open yet. Each year, it doesn't open until May around Mother's Day, but they've decided not to open the areas where people would normally park and then walk into the park, because it's just hard for them to do any kind of enforcement. They've got a very small staff at this time of year. The bathrooms aren't open. They don't, clean the equipment outside. There's nobody wiping it down, say after children play, and so they're and they've also witnessed that even when people go into the huge park, they all tend to congregate in the same area. Again, frustratingly so. So, although we haven't given an order to them to shut the park down, they've made the decision not to open it up, and they were also looking at their summer programs, for example, their Sunday and in the concert series. For the next couple of months, they've already decided not to have those. So they're looking ahead, like we all are, I guess, to better times. But for the time being, they're just not opening. They're not laying out the red carpet. They're not saying, "Come on in and hang out," because folks aren't even in the park. They're not practicing that social distancing that we want them to.
Okay, thank you.
Thanks, Vinod.
All right, is there any other questions? Any other media joined the call besides the Republican and 22 News? All right. Well, sir, if you have any closing comments, you can make your closing comments, Mayor, and
yeah,
we'll
I want to just express appreciation, continued appreciation again to each of you on this phone call today for the work that you're doing for our city and for the residents that we serve. Sometimes it feels like it's not appreciated. I think sometimes we feel like we're at the center of it and everybody who gets mad turns it to us. But I know that's not the case. I think people in the community do appreciate the work that's being done. There's always going to be a couple of negative Nancy's out there who don't like it. But on the whole, we're doing the best we can with a playbook that's never been seen before. And I said this in an earlier call today. There is no set of directions for, what do you do during a pandemic outbreak in your community, in your state, or in your country. We haven't faced that in modern times, and so we're all kind of holding out, waiting to see what the governor decrees or what the mayors may say and that kind of thing. But none of us know the actual answer. We're making this up as we go along, and quite frankly, we're doing a pretty good job with it. I don't think our city or any city around us have made any major mistakes. We're doing the best that we can do. It obviously is only successful with the help of the residents that we represent, and people have, by and large, been very helpful with that. So I want to say thank you again to our professionals that are working so hard. Keep up the good work. We do see light at the end of the tunnel. At the end of the tunnel, we don't know exactly when, but we know it's coming soon. So I say thank you again on behalf of the people that I represent, and thank you for being a part of the call today.
Thank you, sir. And with that said, that's the end of the call for today. Thank you.